all of this could not be possible without our wonderful sponsors and donors. So this virtual hangout is brought to you by our presenting sponsor, West, our supporting sponsors, Merck, Daiichi Sankyo, and Lilly. We do well over 60, I feel like, of these a year now, and with 48 cooking demonstrations that Erin and her team execute as well. And it's just outstanding the type of knowledge that we can bring, and we can't do it without the support of those that are sponsoring and donating. So thank you to those four presenting and supporting sponsors, and we are most grateful. All right, Erin, I see you are getting ready. You have a wonderful mocktail for us. I am going to spotlight you front and center. We all know Erin, our host that is always here with you on the virtual hangout, and she's going to lead us through a fabulous mocktail for this evening. Erin, take it away.
I love this. I love kicking off our virtual hangouts with a mocktail or with a fun little app or a warm beverage, because I think it always sets the tone, right? We like to keep these casual. We encourage discussion and questions, and this topic is just as important to encourage opening up and asking those questions that sometimes we're a little bit shy about asking, but we have the best of the best with us tonight. So let's start getting cozy with a mocktail. And I'm making a mocktail this evening that is, I think, a more common mocktail. So we'll be making a Paloma. So a Paloma is based in grapefruit, and I'll be sharing some really fun nutritional food for thought information about grapefruit as I'm sort of moving through. We'll also talk about how you can substitute grapefruit for those that may be on a medication where there's an interaction, because as much as we love grapefruit, sometimes it's just that sticky food that interacts with some of our medications, and we want to make sure that you are ingesting it safely. So we'll talk about that once we get through, but let's make our mocktail. So I have it here. Where is my, I should have been a weather person. There's my mocktail there that I'll be making a second one. And I point that out because remember, mocktails can be made in your favorite glass, right? So I have mine here in my favorite Unite for Her glass, but I'm also going to be using this fun little margarita glass. So grab that beautiful glass that you love, because we still want our mocktails to feel special and tasty, and we want the presentation to be on point. So with that being said, the first thing we're going to do is rim our glass. So you could use any sort of liquid that you want, even if you just want to use a little bit of water. I will be rimming it using my grapefruit here. So I'll just take this around the outside. And then what I'm using is a little mixture here of some salt and sugar. So it just gives a little bit of salty sweet. And I love the color because it complements the white and the orange. If you can see, that kind of complements really nicely the color of the beverage. So we've got that started. I'm going to grab some ice, because what you'll need is just any sort of mixing vessel. So there's no shaking, there's no jostling, any kind of spoon and a mixer is what you'll be using. So I'll be grabbing some ice because we want to chill this. This is one of my favorite mocktails to make, so we want some good ice in here. Oops. All right, let's start off with some fresh lemon juice, because we love those fresh ingredients. So this recipe calls for 1 ounce of lemon juice, which is generally about half of a lemon. If your lemon is really dry, maybe it's been hanging around for a while, squeeze both halves. So we have 1 ounce of lemon. Now we have fresh grapefruit juice. So you could absolutely squeeze grapefruits. Mine are a little bit large for mine, so I'm just using some freshly squeezed from the grocery store. So we want 2 ounces of this. So this is 1.5. So let's talk about the benefits of grapefruit, because they are a lot. If you didn't know, grapefruit actually originates from Barbados. And it's a combination of an orange citrus and a pomelo. So if you're familiar with that large citrus fruit, a pomelo, it really does look like a beautiful combination of the two. And like a lot of our citrus, it's a wonderful source of fiber, which is really, really important for so many reasons. So I like pointing this out because February is also Heart Month, right? And fiber is so good for our heart because it helps us with regulating blood pressure. It also helps with lowering cholesterol, getting fiber from a lot of our different plant foods, because remember, fiber only comes from our plants. So that helps with lowering cholesterol. So incorporating grapefruit can be a wonderful addition for a heart healthy choice. In addition, we know fiber is just really good for gut health as well. So all of that fiber helps feed the healthy bacteria. So we create a nice, healthy microbiome, which helps with reducing inflammation. So again, fiber that we can get from any of our plant foods, including our citrus, is a really wonderful addition. So number one, we love it for fiber. Our next ingredient, before I jump on the second really wonderful nutrient that can be found in grapefruit, probably most of us know here, I will be adding a little bit of simple syrup because we have some tart, we have a little bit of sweetness from the grapefruit, but I'm using just a little bit of a simple syrup just to add a little more sweetness. This calls for 1 ounce of that. And I'll put, oh, nope, I'll grab my spoon and then we're just gonna stir this. We want it to chill really well. So while I stir, let's talk about vitamin C, right? Because when we think of citrus, we think of vitamin C. Grapefruit is packed with vitamin C. In fact, just one medium grapefruit, so not even those large ones that we see, but you can see sort of the half of what this size is, gives us all of our daily needs of vitamin C. We think of vitamin C for immunity. Of course, it supports our immune system, but vitamin C is also really important with absorbing both calcium and iron. So for those, when we connect with you about how we can support your bone health, whether you're in a situation where you have some bone degradation, osteopenia, osteoporosis, and we often talk about calcium, but I like to say, make sure you're getting that vitamin C because it boosts our body's ability to absorb calcium as well as iron. So vitamin C is a really wonderful helper nutrient. In addition, vitamin C is actually really important for wound healing. It plays a very important role at the cellular level. So anyone that not only has had recently surgery, but for anyone that may have had, for instance, radiation, where we're seeing some skin alterations, we think of wound healing. And so making sure that you are incorporating vitamin C foods so that we promote good skin healing and tissue regrowth, right? You don't have to go crazy with quantities, but just incorporating throughout your day is a really wonderful addition. So vitamin C is super important. Let's strain our drink. So into our beautiful glass, let's strain. Let's try, there we go. Oh, beautiful. And don't panic if it doesn't fit all of it, because we're going to top it with a little bit of soda water or club soda for a little bit of bubbles. The last nutrient I want to call out about grapefruit is actually vitamin A. And this is unique solely to grapefruit. You don't find all of this beautiful vitamin A in our other citrus, our lemons, our limes, our oranges. Again, one medium grapefruit provides 100% of our vitamin A needs, which is crazy because it's like a wonderful source. Beta carotene, a precursor to vitamin A, really, really nutrient dense. So again, another reason to enjoy this mocktail, to incorporate grapefruit in your snacks as part of your meals or breakfast. Now, here's the caveat. Grapefruit's a funny food because, like I said, it does interact with some of our medications. So most of us may know that grapefruit interacts with statins. So some of our heart medications, think atorvastatin, lovastatin, and simvastatin. So those are your generic names that you really should be avoiding grapefruit if you take any of those. In addition, our hormone medication, so tamoxifen and our aromatase inhibitors does interact with grapefruit, and Ibrance. So unfortunately, if that is a medication that one of our members here is on, we want to be avoiding grapefruit. But the benefit of this is you can swap this out with something like the varying oranges that we're seeing right now in season, right? So maybe we're using some fresh Sumo orange juice from the Sumo oranges that we see, or just your favorite navel orange, or all of the beautiful pink oranges that we're seeing. So other citrus that we know doesn't have that interaction, you're perfectly safe to create a really wonderful mocktail. So Really important food safety. And of course, if you ever question whether or not you're on a medication that may have a food drug interaction, remember your best friend is your pharmacist. This is what they do. So if you ever want to just double check, making sure that everything is okay, ask your pharmacist and they can very happily confirm that for you. So we are finishing up by garnishing with a little squeeze of grapefruit. And here we have it. This is our beautiful, really lovely mocktail. Oops, let's take a sip. Let's spill and take a sip. Oh my gosh, that is delicious. Yes, you will love that. It has the tiniest punch of tartness a little bit from the citrus, but it really balances out nicely with the simple syrup and even with a little splash of sparkling. So we love that. So cheers to all of you. Happy conversation about dating and cancer tonight, because we're going to get into some really good information with Sabitha. Cheers to Sabitha, our favorite Unite for Her advisor on this topic. And I will happily post all of those ingredients in the chat for you. They will be on our blog. But if you know that you have these ingredients nearby or you want to play with them yourself, maybe you're whipping this up on your own, and then we'd love to see your cheersing on our social media. So cheers to you. And let's get to the main show.
Yeah, I have a couple questions for you though. Hold, not too fast there, Erin, not too fast. So
Okay.
First of all, yes, I agree, Amy. Erin's knowledge is incredible on nutrition and she just teaches me every day. So I'm fortunate to be next to her as a colleague. We did have one, why do they recommend avoiding citrus when getting radiation? Do you know about that, Erin? Have you heard of that?
I have heard of that. And so I think there's a little bit of confusion with avoiding citrus. So that recommendation usually comes from a place of really pointing out antioxidants and how they could potentially affect radiation. So I should say that even that interaction hasn't really been clearly proven with science and data, but the theory is that radiation produces, by nature of radiation being what it does, produces free radicals. Vitamin C, high in citrus, is an antioxidant. Its job is to fight free radicals. So that recommendation usually stems from the conservative viewpoint of let's sort of minimize any sort of anything that could potentially not allow radiation to do its job to full capacity. Here's what I normally say. Yes, if you take any sort of supplement of vitamin C, high dose antioxidants, you do want to stop that during radiation. But it is perfectly safe to consume citrus in normal amounts from whole food sources. The risk of it impacting radiation at all or to any degree that it would not benefit a patient is pretty slim to none. So that's kind of where that theory comes from. But again, you can feel perfectly safe about incorporating these fruits among your other fruits in whole food form.
Yeah,
that's a great question.
Karen,
Great question.
Karen was saying she's always craving, right? She's craving the citrus and the clementines, and and that's where you just want to get that knowledge, Erin. And thank you for clearing that up for us. Yeah.
Absolutely. Yep, that great question.
All right. Well, I'm loving our food for thought moment. Thank you for bringing it to us.
Oh my gosh, absolutely. And so thankful to our partners, Lilly, for really supporting us. It's just like driving our food education to the next level. So we're so grateful to them.
Great. All right. Well, I am ready to bring on our main show, right? So, Hi there, Sabitha. I'm going to actually add you to my spotlight. Thank you for being with us. Sabitha has been with us for well over 10 years as our sexual health advisor. And I always feel so honored to have the privilege of introducing you because you become such a friend to Unite for Her. You allow us to ask all the questions and walk away with tools that we normally would not have had, and give us an approach that's really accessible and something that we don't feel like is too unreachable to try, right? And to sort of get out of our box when it comes to sexuality and sex and just understanding how it impacts our cancer diagnosis or I guess the opposite, right? Our cancer diagnosis impacts our sexual well-being. So let me do a little bit of a bio on you, Dr. Friedman. So here, Dr. Sabitha Pillai-Friedman is an associate professor at the Center of Human Sexual Studies at Widener University. She is also a relationship and sex therapist at Rittenhouse Relationship and Sexual Health, plus has served as a sexual health consultant and provider for Unite for Her since 2015. She is an ASECT certified sex therapist and an ASECT approved supervisor. She works with individuals and couples in her private practice in Philadelphia. We were joking that she's actually Erin's neighbor. So one time we're going to do this and they're going to be together in her kitchen. Dr. Pillai-Friedman has had more than 25 years of experience in providing individual, couple, and sex therapies and presents both nationally and internationally on wide-ranging topics related to relationships and sexuality. So, Sabitha, I am going to let you take the floor. Thank you for joining us.
Thank you so much. I don't know if I can really follow up on a drink of Paloma with whatever I'm about to say, because that sounds so much more seductive, but I will try my best.
It might be a tool. We might have to use that as a tool. That's all.
Oh, absolutely. It could just be the social lubricant that we need. So that's good.
Right. That's right.
So, dating, I hear about dating quite often. It comes up a lot in my practice. So it does, there are many different groups of people who talk about dating. For instance, it could be a single person who has been single throughout the treatment and is now looking to date someone. It could also be someone who has been in a relationship, but the relationship has ended and needs to reinvent themselves. They need to reinvent themselves and then meet somebody. I also hear from people who are in a relationship because the relationship changes a little bit after the cancer diagnosis and treatment. So how can I date my partner again? How can I bring in that excitement of dating? So these are the different groups of people who bring up their questions about dating to my office every day. I just have to plug in my computer. I realize, I'm so sorry. But please ask me any question and I will respond.
I'll actually start off, Sabitha, because while you're doing that, because I think when we think of relationships and cancer, maybe dating isn't something that comes to mind, sort of that stage of a relationship. So I would be curious how often that is a concern from the Unite for Her members that you work with, or even your own patient population. How much does this sort of question and discussion come up as a concern, that actual dating stage versus being in a relationship, having a partner?
Well, equal amount, because I see a lot of single people. I also see couples. So, so the issues that they bring up are related to, I think of dating more as, putting yourself out there. So when it comes to putting yourself out there, it could be as a single person. It could be also someone in a relationship. Like, how can I now reinvent or reframe my relationship with my partner, because my body has changed, my mind has changed. How can I do that? So I hear this from pretty much everybody I work with. Yes, very, very common.
Okay. Are there particular challenges that people bring up to you when they are entering back into a dating scene, whether they're coming out of a relationship and starting a new one, whether it's a marriage, a long, that might be unique to that particular population?
Yes. A lot of people talk to me about the insecurities that they're feeling about revealing their health status to a stranger. So in the dating world, how do I bring it up? And when do I bring it up? And sometimes people have, worries about how they look, how they present themselves, how their body feels Am I ready to date? Am I not ready to date? What is a good time to date? So how do I find people who would accept my diagnosis and be comfortable with it? So these are some challenges that people talk about. And, sometimes people talk about, treatment procedures such as surgeries, chemo and radiation has affected their bodies in different ways. So, with surgery, that could be pain, that could be numbness, that could be, changes in appearance, scars. With chemo, that could be hair loss, that could be other physical changes that they may be experiencing, radiation, sometimes the skin texture may change. So how do I now go out into the dating world when my body doesn't feel the way it felt before? So this is something that people bring up frequently.
Yeah.
I have a
When-
question. Sure. Are you? Go ahead, Erin.
No, please, by all means, go ahead.
Okay, this is Carol. I was wondering if you would advise to not even think of the word dating, but to reach out to find friends. Because I had a process in mind that, okay, I register on some sites, but after the first one and the first day and I got inundated, I backed away. It's like, okay, I'm not ready to be into, but persons who may reach out to my profile on Facebook or so, that's where I kind of entered, and I felt a little more comfortable because the word dating was not the primary scary thing. So how do you navigate that?
Well, we are all different. So
Mhm.
we all have ways of connecting with people. So it looks like you connect better in a neutral environment where there's no expectation. So you can start off as a friend and then you can see where it goes. So that is most comfortable to you, which is fine. So you have to find the avenue that best suits you for your connection. So you may end up with a lot of friends and you may feel like you want to date one of them. So
Hopefully.
yes, I wish you luck.
Thank you.
Yeah, Sabitha, we actually had two. Melissa had shared in the chat that she was going to start by just saying that prior to her diagnosis, she had this big goal of to start dating, the goal of 2023. Not that she needed one more excuse to add to why she wasn't getting out there and dating. And now she has been diagnosed with breast cancer, right after Christmas. So she would just love, it's just a challenge, and she would just love some guidance and encouragement. So what would you have to say to Melissa?
Melissa, I really, really appreciate you bringing this up. And I think you're ready to go out and date. So you will have to listen to some of the advice I have, the tips that I have, and really go out there and see what's out there, and try to explore the options that are out there.
I love that. I think maybe by showing up tonight is Melissa's subconscious way of being like, I think I'm ready. I think I can do this. This is sort of some good good support to get that started. Although, the intimidation is definitely there, I'm sure.
Yes, absolutely.
Joanna actually had a question too, and I know we had a couple from our audience prior. She had just talked about, what's your take on putting something about cancer in your online dating profile?
Yes, I know. People ask me all the time, do I put my cancer status in the dating website? But I have, again, there are many different viewpoints. So I can talk about what I feel would be in the best interest of people affected by cancer. Cancer is only one part of you. It's only one part of you. So you are so many other things. you are, an artist, a teacher, a mother, a hiker, a singer, all these different things. And in Aaron's case, a nutritionist and a chef and an amazing, TV personality. So, when you have all these different aspects about yourself, cancer is only one part of it. So in my opinion, I would like your date to know you in your entirety. So first, let them see who you are, that you are funny, you're humorous, you're filled with life, you have hobbies that are very exciting to you and that your date may also enjoy. And you can mention your health status after your first or second date, because not everybody, there are so many other diagnoses that people get, like, they have high blood pressure, they have diabetes, they have, sometimes even more catastrophic conditions. People don't put that on their website. People don't put those in their dating profile. So my suggestion is to first meet the person and let them get to know you for who you are, and then you can talk about the diagnosis. Again, that's my opinion. That may not be the opinion of other people you speak to. You'll have to pick and choose what you feel most comfortable doing.
Thank you. We actually have one that wants to come off mic. So Sharmella, I'm going to let you take the floor. Go ahead.
Sure.
Hi, thank you for all the information that you're sharing too. It's very useful. I am actually in a relationship with someone I was with prior to my diagnosis. I'm finished with treatment and everything. So now my body is going through that point of its healing. And I don't know if you can answer this for me or not.
Sure.
Because the chemo put me in could be temporary or permanent, I don't know so far, menopause.
Mhm.
Intimacy has changed for me, and it's kind of embarrassing because I'm young and it's painful. So
Mhm.
like, I don't know what I can, it's the first time I've ever experienced this in my life, what I can do to make that more enjoyable, because I
Mhm.
don't do it at all because it's just not enjoyable for me.
Thank you so much for speaking about this, because this is something that we should be talking about more often. And healthcare providers should be talking to people about sexual pain. I want you to know, do not have sex through the pain.
No, I'm not. Trust me.
Yeah.
I like sex, but I don't want to, I want to be enjoyable for me too.
Yes. So it is not normal to have pain, but it is unfortunately an inevitable sexual side effect of chemotherapy, because your body goes into menopause. So there's vaginal dryness. So your vaginal walls are dry because there's no estrogen that can lubricate your vaginal walls. So the most important thing for you to consider is to use moisturizers and lubricants that do not have paraben in them. So I know that, so you've been giving out samples of Good Clean Love that are lubricants and moisturizers. So the same way we would moisturize our bodies after we shower, we need to moisturize the vaginal area with an applicator, so you do not experience the dryness. And it would also be helpful to see a physical therapist if the pain is continuing, because you may suffer from what is called pelvic floor dysfunction, which is high tone pelvic floor dysfunction, which is when your pelvic floor kind of elevates because of the vaginal dryness. So it would be helpful to see a physical therapist. There are physical therapists who focus on pelvic health.
Okay.
So yes, and if you go to one of them, the Penn has people attached to their oncology center. Jefferson has, so big hospitals usually have pelvic floor physical therapists.
Okay.
They
And
will do massages, and they
okay.
would really work with your pelvic floor. And
Okay.
you can then use what are called graded dilators to sort of work on it yourself. So you sort of coax your vaginal walls to kind of get lubricated and relax. So then, any kind of penetrative sexual experience can be pleasurable for you.
Okay. And does that last forever? Is that something I have to contend with forever?
Well, I wouldn't say, I wouldn't think of it that way. I would think of it as something, the way we moisturize our bodies, we take care of ourselves. It's a way of it's self-care. It's really, I want you to think of it as self-care.
Okay. You're
And
right.
and the more you sort of take care of yourself, and the more you enjoy your sexual connection with your partner in many different ways, just find other ways to be sexual. So when you are engaging in penetrative sex, you can kind of stop as you want, so you don't have to go all the way. Then your body will start easing into this experience.
Okay. Thank you so much. Thank
You're
you.
welcome. You're welcome. And I want you to know, you should feel totally comfortable speaking to your healthcare providers about this. This is a very common experience of people who go through chemo and who have hormone therapy.
Okay. Thank you so much. It makes me feel a lot better. Thank you.
Absolutely. Absolutely. Take care.
Carmela, I'm going to jump in there because Sabitha, you know my story. I'm one of them. I was 39 and I went through exactly what you're talking about. And it was definitely, it took some time, Sharmela, and some of the other people that are asking about that. The lubricants and the moisturizer is self-care, and that Good Clean Love, they have, a really wonderful line. It's all vetted by our providers and our professionals here. I feel good about using that. Sometimes it tingles a little bit, and that's just that vaginal wall getting used to it. As you start to use it more and more, it's going to not have that feeling anymore. But it is key. I know it's key for me, for a sexual experience, that I have that. And when I went through my cancer diagnosis, I lost, same as you, right? I went through menopause, and acupuncture was able to bring me back out. I was so grateful for that. I did continue. I did not go on any type of tamoxifen, so I had the opportunity to come back out, and I did, and that helped too, right? So like Dr. Pillai-Friedman said, it's going to take a little time. It's going to take a little time, and it's a new normal, and you are so not alone. You're so not alone, and there's a lot of tools out there that can help you.
Thank you. I just
Absolutely.
feel fine. Thank you.
Yeah.
Thank you for sharing that, Sue.
Yeah, you're welcome.
May
So
I
we
ask
have
another
we have a
question
couple more.
or somebody
Yeah,
else?
go for it.
Okay.
Yeah.
Okay.
Questions?
All right. Of course, I'm looking forward to the experience. That has been on my mind ever since I had my hysterectomy. And, I have all kinds of questions about what I will feel and how I will feel and things like that. And the scar, what I wonder if there are some non-toxic kind of tattoos or something that you can do to make it interesting, because that's what I've been thinking. I've got one that goes from the bottom straight almost to my chest, right onto my breast. But when I look at it, it looks beautiful to me.
Yeah.
But I could see, what kind of non-toxic things can I do to kind of make it look more attractive?
I have heard of non-toxic tattoos as well. I know that there is you may know about many other tattoo artists, but there's an artist in Maryland who called Vinny. I have to find the link, and maybe I can help you find it, who specializes in doing 3D nipples for people who have had mastectomy and reconstruction. And so, he was also talking about doing other interesting tattoos for people who are going through, who have scars that they would like to. I think it's a way to reinterpret the scars. I feel like let's welcome the scar, and if we want to kind of reinterpret it, let's put a little leaf on it, let's put a little flower on it, let's put some color on it. So absolutely, if you feel that it's going to make you feel better, go ahead. I think that is the key to dating. Whatever makes you feel better, do it, so you can be confident when it's time for you to kind of show your body to somebody.
Thank you.
Yeah, Erin, I see your hand is raised there. We have quite a few questions coming in the chat as well. Go ahead, Erin.
Yeah, definitely. And I wanted to kind of go back a little bit. This is to Caitlin's question, but also sort of going back to that timing question, because I think there's so much uncertainty around like timing of when this comes up. Like, is it a first date thing? Is it a third date thing? Caitlin mentioned like, there's changes that she's experienced, very visible, like hair. Now you're on a dating site. Do you post the picture with the short hair? That's where you are. Do you do one when you used to have long hair? How do you manage those waters? I think that's a great question.
That is a great question. There are no hard and fast rules. There are no hard and fast rules. And if you want to, if that would make you feel comfortable to post the picture as you are right now, then please go ahead and do it. But I would like your date to know not just who you are as a cancer survivor or someone who is diagnosed with cancer, but as someone who is all the other things. So bring in your joy and your fun self to the date. So let that not be the only conversation you have. But absolutely, post a picture that makes you feel most comfortable.
Yeah, and I guess maybe it can be something where there can be lots of different pictures with lots of different hairstyles, short and long, and
looks,
and it
right?
sort of speaks to the whole person, not like this one moment.
I love that idea.
I do too.
I love that idea. I have a picture of myself with, I'm also a cancer survivor, so I have a picture of myself with really short hair. Which I used for a long time because at that time that was what I looked like, and I just had all my websites have that picture. So it's fine. And now so occasionally when I Google myself, I find that image of myself and I am reminded, yes, I looked like that at one point. But I love your idea, Erin. Have different pictures so they know what you look like before, what you look like after, what are you going to look like 2 years from now.
Right. Cancer doesn't define you, right?
Absolutely. That is one thing we should never give up, the power to claim ourselves.
Yes.
So cancer doesn't claim us entirely. It's very important for us to keep that power within us. This is me, and these are all these wonderful aspects of me. And cancer is only one part of it. And I'm only going to give you this much space in my life, no more.
Yeah. There was one question here, and there's a lot of natural remedies that can be really helpful for vaginal dryness. And I know we've talked about this before, Sabitha. How about coconut oil, olive oil, apricot kernel oil applied vaginally? Can you give us some thoughts on that, as well as, I remember the Replens and Restore brands of vaginal moisturizers. So I thought maybe you can touch on those. We just said good, clean love. So, make sure you get over there, good, clean love.
So when it comes to moisturizers and lubricants, the most important thing to remember is avoid moisturizers and lubricants that have parabens. Parabens are not good for our vaginal health. So especially if you're a cancer, if you have been diagnosed with cancer, it is really not a good choice. Secondly, I really would like you to avoid moisturizers and lubricants that are warming, cooling, arousing, because all of these have menthol in them.
Yes.
And the vaginal walls of people diagnosed with cancer is very fragile and very sensitive. So you don't want to put something like menthol on it. It can really cause irritation. The third is most healthcare providers feel that oils can trap infections because it's not easy to clean. It's not easy to remove from your vaginal walls. So it's recommended that you use oil-based lubricants and moisturizers. So coconut oil, unfortunately, coconut oil, olive oil, all of these may not be really may not be very good for people who are diagnosed with cancer. Sometimes the oil-based lubricants and moisturizers can kind of disappear soon. So during sex play, sometimes it's not enough.
Yeah.
So it's better to think about using something like what are those? I'm blanking out on this. The silicone lubricants, silicone-based lubricants. Silicone-based lubricants are actually, they last longer. So some of the sex educators who work with cancer survivors tell me that it's good to use the oil-based lubricant first, and then use the silicone-based lubricant on top of it as a top layer, and that would keep them, you know, it would last longer through sex play.
I'm sorry, Sabitha, so use a water-based or an oil-based? Which one?
Only water-based.
Only water-based, okay.
Yeah, water-based and silicone-based. Silicone is not oil, so silicone is actually considered quite reasonable for cancer survivors.
Okay, but if you combine the two, have your oil-based first and then put your silicone one on top or your water-based one on top, that helps with that concern?
Yes, the concern of running out of lubrication in the middle of sex play.
Okay,
So use the oil-based first, and then use why am I having a hard time with this one word, silicone-based? I don't know. So using the silicone-based on top of the water-based is a good way to prolong the lubrication.
okay. I think you might have said just oil-based in there, but no oil-based at all, all
No
silicone-based,
oil-based at
water-based.
all.
Okay, just making clear, just so that we're getting that straight. Thank you
Yes.
so
Yeah.
much. Erin, I know you had another question that came through our audience.
Yeah, and this was a great question about how to discuss the diagnosis for dating when someone has a metastatic diagnosis. You know, treatments will not end, things may change. So how does one and when does one talk about that?
It's a great question again, and you know, bring it up when you get to know the person, maybe after the first or second date. Ask about the date's health status, and then you can share your own health status, and you know, talk about your diagnosis and the outcome, and you know what the prognosis is. And so it's okay to share after the first 2 dates. Let them know that about who you are and where you are in your health journey.
I love that. Is it, you know, in a person's mind, sharing this diagnosis is a big deal, right?
Absolutely.
If we're able, and it is a big deal, but sort of framing it in our mind, what do you think about, you know, it's sort of like, so I'm using this analogy, bear with me. You know, when a child falls and we don't want them to cry, we're like, it's fine, just rub it off, we're okay. And then they get moving again. And it's like, okay, if we want to share this, if we put a lot of attention on sharing this diagnosis, maybe it comes off as a lot for the other person receiving that information. But if we share it in such a way like, listen, I had this diagnosis, I feel really good, I have a great team behind me, you know, and you sort of share it in a way that it's conveying that it's just a piece of you, not to say that it's not as important, it's not significant, but we're sort of controlling how that message is perhaps conveyed and then in turn received. Is that sort of a perspective that a person can take?
I love that perspective. really keeping it light and, kind of sharing it as a matter of fact thing, as opposed to this earth-shattering thing would be a really, because you're conveying your emotions around the diagnosis and treatment. So that could make your date feel more comfortable.
Right.
I think that's great
Absolutely.
perspective too.
Terrific
Yeah.
idea.
We had another one here that talked about just looking at the health of the vaginal wall and discussing vaginal atrophy. And I know you talked a little bit about the pelvic floor as well.
Mhm.
Could you share a little bit more when does that usually start if you had vaginal atrophy?
Well, vaginal atrophy, is the result of estrogen deprivation. So as soon as estrogen and progesterone is depleted in your body, you start suffering from vaginal atrophy. Vaginal atrophy is when the walls of the vagina dry and they become sensitive. So this is exactly why I tell people not to have intercourse or any kind of sexual experiences that are painful, because the vaginal wall can bleed, and it is not healthy for the vaginal wall to bleed. It's not normal, it's not healthy. So that is why it's really important not to bear, grin and bear it and bear, the pain that you may experience. So the atrophy can happen at any time, depending on the age of the person, because younger people, it may take a little bit more time, and also the intensity of the treatment. Because if the treatment is, the chemo is a, kind of an intense chemo, then the atrophy may start sooner than later. And also, if the treatment is combined with hormonal treatment, the chemo is combined with hormonal treatment, then there is a chance that the atrophy would start sooner than later. But there's treatment. When the word vaginal atrophy, people tell me, it's just, I hate to hear this. It makes me scared that there's something really bad is going on. But there are treatments for it. There is a way to cope with it. You just have to find out what it is. It is like the lubrication and the moisturizing, and using dilators, graded dilators, going to a pelvic floor physical therapist. These are all ways in which your vaginal atrophy can be managed. It will not go away completely while you're still on the hormonal treatment, but it can be managed. So your quality of life can be much, much better.
Sabitha, could you walk through, like when you go to a physical therapist for pelvic work or for the pelvic floor? I'm very familiar with the exercises and those tiny movements. You had mentioned massaging. How exactly is that done? Is it done internally? Is that something that
is done internally? So the physical therapist will, use their finger to massage your vaginal walls, especially your pelvic floor. And so, so this is one of the things that they do. They would also do other things to sort of, first of all, they'll examine you to see how tight you are and what your pelvic floor looks like. They'll look at the pelvic floor health. And then they would either do massaging, they would also suggest dilator treatment. So all of this is to just like really kind of press down the pelvic floor so it's supple and easy to, sort of heal. It heals through the pelvic floor treatment.
Thank you.
I have a question just on Tanisha's sharing in the chat, which I think is something that many of our members here tonight can understand, is the anxiety around intimacy. And so she had reconstruction, she hasn't dated, but the thought of having to tell someone that she doesn't have a real breast is enough that she hasn't dated with someone, and she's working on it. So bravo to you. But any advice for the intimacy setting and sort of working on the changes that may have come along with this diagnosis?
That's a great question. You know, I frequently work with people who are worried about scars or, you know, the way the breast looks or any other changes that they have experienced. You know, if it makes you feel comfortable to keep your bra on and say, I feel better to keep my bra on, or wear a lingerie that covers the scars, it's totally fine. This is, it's very important to negotiate these things and say, I'm at a stage in my life, I just don't feel comfortable taking off my bra. Is that okay? And continue with that. And, you know, and the same way, you know, wearing lingerie that covers a few scars, that's okay too. And, you know, once you get to know the person, you may be, at some point, you may be okay, you know, removing a bra or, you know, taking off your lingerie. But initially, you can negotiate ways you want to present your own body. So that is, yes,
Yeah.
important to remember.
And you may be surprised on the other end what you get, where they're very compassionate. You know,
Absolutely.
we keep thinking the opposite here, right? But the bottom line is that they could actually approach it in such a loving way that just eases all of your worries. It's just the unknown is worse, and we make up the story and fill in the blanks, right? And
Absolutely.
yeah, you don't know until you get out there.
I have heard of so many compassionate partners.
Totally. Yeah.
I have heard, and I have guided so many people through the dating experience. I have helped people write their dating profiles. I have supported them through this experience. And I know a lot of people who have met awesome, very compassionate partners. So they're out there. They're out there. So
I
when
love
I'm
that you
on
help
that,
people write their dating profile, it's just like having somebody there to say, will you proof this for me? You know,
exactly.
take a look at it.
It's
I use a different word, you know?
That is the fun part of my job,
Yeah.
editing dating profiles.
Yeah.
So there's also, I want you to know that there's also this great resource that I want you to know about, which is there's a website called C is for Cupid. And this is a website that was created by a cancer survivor. And it provides a safe space for people affected by cancer to meet compatible dates and friends. So this is also a place that people can meet friends.
Right. Like our first question was, right? She really enjoyed being friends.
Yes. So
I'd love to open the floor up a little bit, if it's okay with you. The people who would like to share their story, Erin, I know you had seen that as well, is that we have some of our, community tonight would love to hear some other stories about dating that possibly could help other people with their experience. If anybody wants to do that, please just, raise your hand. We'll call on you. Or Sabitha, if you have any questions or any stories that you would like to share to get things started, maybe with our last 5 minutes, that might be helpful.
Well, the only story that I have is that, I work with people who have met really wonderful people. And, and sometimes people ask me about rejection. Rejection is a part of every dating life. Everybody who dates has to expect to be, so there are some people who may not want us, they may not like us. It's okay. And they can meet someone they like, and we can meet whoever we like. So remember, rejection is not unique to us, to the, people diagnosed with cancer. It's a reality for everybody else.
Yeah. I'll wait and see if anyone raises their hands, but a couple questions. One thing was, what is the name of that website that you just said?
C is for Cupid.
Thank you. C is for Cupid. Thank you. She said it doesn't seem to be operational anymore.
Oh.
And then the other question, we'll look into that for you, Nancy.
Yes. Yes.
Greece, yeah. The other one was, are your services available with the passport? And they are. So,
Yes.
we do pay for sexual health counseling. If you still have a valid passport and are in our area, that you can connect even online, right? And virtually has had such an uptick now since the pandemic. I think people are much more comfortable, right? To just pull it up on their
It's
phone.
the
or on
best
their-
way. I
It's the
really
best
find
way.
it very, yeah.
Yeah. Yeah, so yes, they are available. So please know that and just check the expiration of your passport. And then I remember, because I actually went to the website and I loved it, was that drawer. Remember that
Yes,
drawer?
yes.
That's a good one, right? It actually just gives you some tools, some toys, some options that you can figure out what works for you on your own first. And then
Absolutely.
bring it to your partner, and or even bring the same exact thing to your partner. But I did love that. I think it's called thatdrawer.com, right?
Thatdrawer.com. It's actually a website. It's actually an online store created by a sex therapist and a team of sex therapists. So they have all these wonderful sex toys, and they talk about it. And they are also on Instagram and Facebook. So if you go to Instagram and you look for our drawer, you will find this online store, so you can learn about new things that they have.
And that's
And
a
your
lot
whole list of
self-care,
resources.
too. Oops, sorry, Erin.
No, that's okay. I was going to say, I think that was part of the resource list.
Yes,
Earlier in the
yes.
chat, I posted the video from last year that Sabitha and I did, and that resource list was tagged along with it. So you can get that website as well as lots of other resources that she shares that we definitely recommend to check out.
Yeah,
Absolutely. I'm always updating it every year, so you have
yeah.
all the new resources.
If you go to, I know Nancy asked to post it again too. We've done a couple with you now, right? I feel like we have a couple of different options. One is speaker series, maybe an Ask the Experts. If you go to our video library on our website, and then you can go the whole library, we haven't taken any of them off. So they are there. You can scroll down, but Erin's going to put it right in the chat again.
Oh, great.
And it allows you to, get right to there with that list of resources.
Thank you.
Yeah, you're welcome. Thank you so much for joining. Any last questions? We'll open up for one last one. I see Kim, you have your hand raised. So how about if I let you just unmute yourself and ask that question?
Hi, Kim.
So I actually didn't have a question. I just wanted to reiterate or agree that like dating, so I'm 62 with metastatic breast cancer. And dating, it's just like being a teenager. Some people will like you and some people won't. I've been on a couple dates. One man was so self-centered that I wouldn't have gone on another date with him anyway. So we never even got around to whether I had cancer or not, because he just only wanted to talk about himself. And then I had gone on another date, and he had lost his wife to ALS and just said he couldn't go through it again. And I've been on a third date with somebody who just thinks I'm wonderful, but he's not really my type. So dating with, and I did tell him that I had cancer because I thought, well, maybe that will make him not so interested, but that didn't work. So we still go like to lunch but I don't want to lead him on. He's just not really, my forever person, but I am still hopeful to have a forever person.
Yeah.
Kim, thank you so much for sharing that. What you've really had many different experiences with all these different people, and thank you for sharing that.
Yeah, I just wanted to say, it's just like dating any other time. Just wanted to reiterate, like you said, that having cancer doesn't really change the fact that we're still just dating, and we might find the right guy and we might not.
Exactly.
Thank you, Kim.
Thank you.
Well, this was a great way to start off February for sure. Thank you again to all of you who joined us and participated, and we learn from each other, right? Yeah, look at that. And we are all still very sexual human beings. Yes, we are.
Absolutely.
Right?
Absolutely.
Just might look a little different. It might take a little different time. Yeah.
And don't forget to be sexual with yourselves.
That's right.
Dating is, I understand why you want to date, but also date yourself sometimes. So your own sexual health sometimes can be in your own hands. So enjoy it. And then also look for someone else who can join you in the sexual pleasure.
Thank you. Well, Erin, I feel like we want to give them one last plug because we have a lot of great speaker series and Ask the Experts coming up this month. Why don't you tell us about that, and then we will sign off.
We have a lot of great things coming up this month, starting with tomorrow evening. So it's our first speaker series of the month, and we are talking about courting or axillary web syndrome. So for anyone that may have experienced that, we'll be diving into both the science and then working with a PT to learn some exercises that we can all do at home. So that'll be a really great speaker series. So much courting, Nancy. Yes. So we will be covering all of it. And then we have a second virtual hangout next Wednesday as well for our Black History Month. We're tapping into our providers, and this is a great opportunity. We'll be touching on yoga and counseling. And in particular, our counselor does eco-counseling. So he really brings nature into it, which is very cool. So if you have considered using your squares, this is an opportunity to hop on with us because you'll get that experience. And then you can decide if it's something that you want to pursue a little bit more, but it'll be a really wonderful interactive evening. And then at the way end of the month, I will say that we are tapping into that potty talk again. So last fall, we touched on GI health. Both Sarah Murphy, our staff counselor, and myself touched on that. So we'll be asking some questions, our Ask the Experts again at the end of the month. Melissa, so that is next Wednesday. It's our second virtual hangout. So it's Wednesday at 5 p.m. Again, next Wednesday, Eastern time. And you can sign up on our social media. It's on our website if you want to register for that as well. It will also be recorded. So if you're not able to attend with us, it will be on her library as always. But yeah, really wonderful. I love how he brings Mother Nature into counseling, and because we know that she is so therapeutic. So we'll be really interested to hear from him.
For sure. Same time, same place. Mm-hmm.
That's right.
Yeah. Well, again, thank you so much for all coming out. We have to thank our sponsors that allow us to have this incredible moving type of sessions for our community. Our presenting sponsor, West, and also our supporting sponsors, Merck, Daiichi Sankyo, and Lilly. Sabitha, thank you so much. We always enjoy.
My greatest pleasure.
Yeah, we always enjoy just hearing your words of wisdom for us, and it does take time. And I'm so glad that we had so many that were so open to sharing their experiences, and we will do it again. Use your passport if you still have it. Sabitha is there. Yeah.
Would you like to share, actually, as I'm thinking about it, your email if someone does want to reach out to you or get connected with you? Can we share your email in the chat? And that way, if you're resonating, which she resonates with all of us, you can reach out to her and get connected.
Perfect.
Wonderful. And thanks everyone for sharing and being vulnerable with us and asking really great questions. Because these are questions that everyone is thinking. So we're glad to have you in our community to support one another.
Yeah.
There. Sure. I just posted my
perfect.
Yeah. It's easy to remember too.
Yes.
Great. All right, everyone. You have a wonderful evening. Thank you for joining us. Sabitha, thank you for everything. We love you. And have a good evening. All righty. Bye-bye.
Bye.
Bye, everyone.